kind of what happened you all the way through to discovering what the problem was.
Right. So as you said, with the iron, hyperferritinemia, that's a problem more often now with metabolic syndrome and diabetes and long-term kidney dialysis and that sort of thing. But in the general population, that generally occurs more in men, maybe 1%. Hypoferritinemia, that doesn't have any complications with it, or just low iron or low serum iron, is a very common problem, but it's horribly underdiagnosed. So I ended up at the end, no doctors were able to figure it out. So it started out with me in my mid to late teens, just being very, very, very tired all the time. And, you always make excuses as to why you're tired. You have stuff going on and, school activities, other things happened where I just had no motivation. So as I got older, it sort of stayed the same. I had depression, some arthritis, some carpal tunnel, things like that. No big deal. When I got older, I started a charity job that was very high intensive type exercise because I was running around outside with a Major League Baseball outfit. As the months went by, I started getting extremely tired. And I mean, there were days where I couldn't stay awake for more than 5 to 10 minutes at a time. And I started having major sinus issues. I've never had a sinus infection, but the allergy type sinus issues, I started to get extremely painful, just pain in every part of my body. At some points, the pain would shift to different locations after a few minutes or a few hours. It was absolutely bizarre. I was sweating like a pig, just walking around outdoors. It didn't matter the temperature. It was just sweat was pouring off of me. I was flushed. My heart started doing weird things. Every once in a while, it would skip a beat, and I didn't think anything of it. Well, when I got to this position, I was a few years ago, it had started skipping 2 beats at a time. And then it got where it got really bad, it skipped 3 beats at a time. And then at the height of this whole thing, 4 beats at a time. And I can tell you, nothing is more unsettling than feeling the blood settle in your body and you trying to Google really quick how to do CPR on yourself. I had blood pressure spikes and dips. I was often had low blood pressure. I had temperature spikes. So my normal running temperature is about 96.8. And I know when I get to 99 because I feel like I'm under a heat lamp. Any sort of stress would trigger it more. So I would get to the point where I would have massive changes and fluctuations. Got to the point where I assumed I had a thyroid issue. So I went to the doctor, local GP, and I asked for a thyroid ultrasound rather. She refused that. And I thought, okay, so I kind of fought for that for a little bit because that's one of the things to rule out. It's not a complicated test. My thyroid's actually fine. My TSH was raised, which goes along with this condition because it is often misdiagnosed as hypothyroidism, and it causes hypothyroidism. So loads of people out there walking around on thyroid meds who just have iron deficiency. I got to the point where the pain in my body became fibromyalgia. Every cell of your body is screaming, and there's nothing you can do to curb the pain. Drinking took the edge off. There is no other medication I could take to even get it down any. I was curled in a fetal position for a day or two, just crying because there's nothing to do about it. I had a little bit of depression growing up, but it got to the point where it was suicidal depression, which I never thought I would be in that condition. I ended up getting bipolar. And, you hear about bipolar and it doesn't get better as you get older. Well, a lot of the times it's just iron dysregulation. I didn't know when it would hit. I would have days like that, or I would go for weeks. I couldn't ever tell, and then it would dip again, and then I would get depressed. A little bit of muscle twitching. I thought, oh, well, I'll just increase the potassium and magnesium in my diet, which it turns out if you do things like that, it can affect iron metabolism. And I'm sitting here every day of my life exhausted, can barely keep focus for longer than 5-10 minutes at a time, face down in PubMed, trying to figure out what is going on and link up all these crazy constellation of symptoms together. And I finally could concentrate enough that I finally, figured it out. And so the next day I had an appointment with the endocrinologist, and I had chugged iron the night before, just trying it out. Within hours, overnight, all but like 8 symptoms, something like that, had disappeared. It was incredible. incredible. And so I walked in and I said, I think I figured it out. And she says, that's good because I have no idea. I actually handed her the paperwork to show what happens. And I said, do you want this? She said, no.
But you've the problem, and none of the specialists can tell because they're specialists. So they remind me of, do you know the elephant, the famous Chinese thing where one guy or gal has got the trunk and says it's a snake, and one's got the leg and says it's a tree, and one's got the tail and says it's a rope. That's the problem often when you get sent from specialist to specialist. Now, you also lighten your wallet enormously. And it reminds me of Michaela Peterson, Jordan Peterson's daughter. She had to go carnivore, but it was because of immune reaction to plant world proteins. And she managed to decode this, kind of analogous to you, in the middle of dreadful depression and crying fits in the shower. She managed to just pull all of what she had left together, and she eliminated everything from her diet and structured an ultra food diary. And she found that she had to go right back to just eating meat. And then it took a few weeks, and that was another problem. There was a lag. So it wasn't that she could cut out the problems and the next day feel better, like you luckily did with an injection of iron. It took a couple of weeks. And then if you took a bad food then, like you started eating tomatoes or certain grains, it could take a couple of weeks before the problem manifested. So that because there's a lag, it's very hard. You need to be ruthlessly tracking your diet. But she achieved success, revolutionized her health, clearly. And I know a load of people now all over the world. I've interviewed some. One guy had bipolar for around 20 years on multiple medications. He went low carb and keto and it kind of helped. But when he went carnivore and removed the plant world proteins that were the thing causing him the problem, he dropped all the meds under guidance within weeks and the bipolar was gone. And he said it was like walking out of a 20-year prison, like literally into a sunny landscape. He was crying during the interview when he told me the story.
There have been studies done that show that at some point in a woman's life, there's over a 50% chance that she's going to have this. And sometimes it's due to menstruation, sometimes it's due to just growth in childhood and adolescence. And so many kids go by the wayside, and behavioral problems can happen, cognitive problems can happen, and all of that can even with birth, which, preeclampsia and high birth weight and low birth, all the things are related to that. But if there's low iron in childhood, it can go all the way to adolescence. Anything that isn't meat can hinder absorption. There are so many things that can hinder absorption. Even coffee drinking, tea drinking. And I was drinking a lot of tea there, so it got to be a problem. And so what I wasn't doing on carnivore keto is eating organ meat. And I think that's part of where I went wrong, particularly liver. It is the best source there is of both vitamin A and vitamin B2. When I look at people's labs, and that's what I do now, because reference ranges generally just tell you what's common. It doesn't tell you what's normal or what you want to have. It tells you what's common.
But generally low iron will indicate that in ferritin. Ferritin is probably, it's fallible, but it's a reasonable good guide. Like my wife was 9, I think, and you were maybe at 20 at one stage. It's very low end. If it's very low end, you got to check all the other measures and check your symptoms and get a proper test. It's a flag, really, isn't it? The ferritin being low.
That's the thing is, if it's low, it's low. Nothing's going to mask that. If it's high, that's where it gets complicated. And of course, the reference ranges can go anywhere from 12 to 300. It's ridiculous. You have to do it by symptoms and by diet, and by what else is going, confounding variables of just what's going on with health. So for everybody walking around out there with anemia, there are 2, 3, 4, 5 people walking around who will never, ever have anemia, but will be iron deficient. And they will have worse symptoms and more varied symptoms than people with anemia. That's the kind of confusing part of this. And so, and the longer it goes on, because it's not going to be diagnosed, it's going to get worse.
And chronic implications then, though you had them from a relatively young age and they just worsened and worsened, other people may have the problem and it's only in their 40s it begins to really impact them. And then sadly, they could spend the next 10 or 20 years descending into a kind of a hell of any or all of these symptoms you described. And basically the medical system almost certainly will not be able to help them at all.